for Nebraska Methodist, we were facing a few challenges surrounding patient access. The first was really the experience, and the second was the quality. So engaging with Experian on a couple of the products that we utilize, we were able to hit both of those challenges for our registration quality and then also for our patient estimates as well.
The client success workshop is really, there's two sides to it. One is more of an engagement where we go in shortly after implementation, validate that a client is actually adopting and utilizing the products that they've implemented. And the other side is what we really engaged with Nebraska Methodist, where we actually go in, we look at KPIs around their products, we look at kind of a baseline of where they're at and make sure that they're achieving at a level that what we consider a good level to see benefits or an ROI from our products.
From the client's perspective, our perspective for the workshop, we dove right in with Experian Health at the elbow. We were able to meet with each one of the staff members directly and in person, and that engagement continued well beyond the site visit that we had. And from our end, it was very valuable to have fully transparent conversations about where we were at and where we wanted to be. I had some soft and some more formal expectations. So from my perspective, I really wanted to ensure that the communication relationship building that brought us to the workshop continued on through, and definitely still see that to this day. And then I did have more formal expectations. I wanted to see some of our denials go down. I wanted to see some of our resolution alert go up. So the one thing I will say that makes Experian Health stand out from the perspective of what does a client expect out of that workshop, some of those, more formal KPIs or metrics we look at are things that other vendors shy away from because they're very hard to achieve, and there's a lot of variables that go into denials and decreasing them. Experian Health is not afraid of that. They're going to dig in right there with you and make sure that you're seeing improvements all through the relationship. And that was hugely impactful for our team. We looked at two key metrics. First, we looked at our resolution rate. So it's anytime one of our staff members has some sort of error in the registration process or when they're first going through our encounters. So we wanted that resolution rate to go up. We're hovering anywhere between 70 to 80%, depending on the day now, which is a huge improvement. And then the second metric was decreasing eligibility denials, but we've been able to decrease them by 50%, which is huge.
Amazing numbers.
Yeah, we're really proud that Experian Health and our team can do that for our patients. It was really impactful to see how quickly we were able to collaborate with each other, and that just kept rolling. It didn't stop. That wasn't just a moment in time. Ever since that first conversation and relationship build there, it snowballed to a relationship with Kevin, with James, with so many other people at Experian Health to help us get to the results we've been able to achieve.